Welcome, and thank you for joining us on this Ask the Experts virtual event, straight talk on chronic back and neck pain. I'm Dr. Desimir Mijatovic, a pain medicine interventionalist. I'm joined today by a panel of Cleveland Clinic pain medicine specialists and a pain psychologist. We're here to answer your questions and share insights on what is chronic pain and how is it different from acute pain? What are the potential causes and triggers of chronic pain? How chronic pain affects the body, the mind, and daily life, and the latest treatment options, including cognitive and behavioral therapies, medications, injections, and other interventional procedures. Before we get to our questions, let's meet our panelists today. They'll briefly introduce themselves and share how they personally keep their joints and back healthy. We'll start with you, Dr. Gerges. Tell the audience about yourself.
Well, thanks, Dismer, for having me today. And hello, everyone. My name is George Gerges, and I'm with the Cleveland Clinic for the past 17 years. I did my residency and my fellowship here in the clinic, and honored to practice here and serve the community. I'm specialized in chronic neck pain, chronic back pain, joint pain. I do a lot of interventional procedures. I practice in Avon Richard Jacob location in the West Side, as well as Lorraine Family Health Care Center in the West Side as well. One thing I do to keep my healthy back and neck is eat well, eat healthy, exercise, and sleep well as well.
Thank you, Dr. Gerges. Now to you, Dr. Paul Shin. Please introduce yourself.
Hi, my name is Paul Shin. I've been in pain management practice for the last 30 years. I did my residency in anesthesiology at the Cleveland Clinic, followed by fellowship at the clinic. And I've been in the private practice for several years. Have joined back with Cleveland Clinic in 2010, and I've been practicing in Medina at the Medina Hospital Pain Center since 2012. My area of interest is spine-related pain, mostly chronic conditions of the neck and the lower back. I do perform a lot of injections of the spine, but also offer other modalities through our clinic here in Medina. For maintaining, if we're seeing patients with chronic conditions, I have always some recommendations on things that they should engage in. For me, I do exercises on a daily basis. Most importantly, when I wake up in the morning, while I'm still laying in bed, I do my knee to my chest to stretch my lower back, and I do side-to-side spine rotation. Then I go on my stomach, my belly. Then what I do is I do extension of the back, then followed by child's pose back stretch.
Thank you, Dr. Shin. Finally, Dr. Lauren Abshire. Dr. Abshire, please tell us about yourself.
Great. I'm very happy to be here. My name is Dr. Abshire, and I've been practicing for about 3 years now as a pain psychologist within the Center for Comprehensive Pain Recovery at Main Campus. And as a pain psychologist, I work with people living with chronic pain. Any type of chronic pain is welcome. I treat it all. And I treat it in a variety of different ways. So I really want to treat the whole person. Very often, an initial appointment with somebody, we really spend time exploring how pain is impacting a person's life, because we know that pain is pervasive and can impact just about every area and aspect of somebody's life. And we know that there's things that we can do from a psychological, a behavioral, a social, and a lifestyle change perspective that have been proven to be effective in helping treat chronic pain, improve mood, functioning, and overall quality of life. So typically I have a person start to engage in some kind of pain psychotherapy, whether that be individually or in a group format, to really help achieve their goals related to pain, functioning, mood, and quality of life. And one thing that I do daily to help protect some of my spine health is really incorporating some form of movement. Sometimes that means going for a walk with my family. Sometimes that means doing yoga or making an intentional point to get up between patients and kind of move around. So that way I'm getting my body moving a bit more throughout the day.
Thank you, Dr. Abshire. And again, I'm Dr. Desimir Mijatovic. I'm a pediatric and adult pain management doctor. I've been practicing pain management for about 3 years, and I see patients out of main campus. My specific area of focus is pediatric pain, and that's the majority of what I see. One thing that I do daily to protect my spine health is a combination of strength training as well as yoga for mobility, and I feel that balance really helps me stay fit and active. Now it's time to answer your questions. We've received more than 200, so we will attempt to answer as many questions as we can. First, I want to open up our first question to the entire panel. What is chronic pain? Dr. Shin, please start us off.
Chronic pain is a general term, quite honestly, but anything that it can be any type of pain that lasts greater than 6 months. Some as short as 3 months, but beyond 6 months, if not getting better, then we consider that as chronic pain.
In addition to what my colleague Dr. Shen said, chronic pain is defined as pain persistent beyond 3 to 6 months. Sometimes they consider it subacute versus acute. Acute is less than three months, and subacute between 3 and 6. And after 6 months, considered chronic pain. Chronic pain itself is not a symptom like acute pain. Acute pain, like after surgery, for example, after acute injury, that's a symptom to alert your body that there's something happened acutely to your body tissue. However, chronic pain is not acting like that. Chronic pain is a disease, an entity by itself, whereas some structural changes happen to your brain, and this experience could last for a good amount of time. And it will require certain attention and specific treatment if diagnosed right at the right time.
And I'd also like to add, too, that the International Association for the Study of Pain even just defines pain in general as an unpleasant sensory and emotional experience that is associated with or resembling that associated with actual or potential tissue damage. And I really want to highlight that that definition includes the emotional aspects that come along with pain in general. And the importance of actually addressing that when we're thinking about addressing chronic pain.
Thank you, team. Our next question is for Dr. Gerges. Why are neck and back pain so often dismissed as a part of aging in middle-aged patients, oftentimes without thorough investigation of the cause?
In the middle-aged group, we're busy raising our families, we are busy with our work, and sometimes we consider that this is normal thing to happen to us if we have back pain secondary to the activities that we do on a daily routine basis. However, addressing these issues early on could prevent this kind of pain from being chronic and being difficult to treat. So considering it, number one, part of normal thing that could happen to us because of our job, because of our busy lifestyle, raising kids, having to work. That's one thing. The other thing, considering it, part of aging process, and I have to have pain. This is normal thing to happen to me. So most often this is missed by many, and missing the opportunity to treat that and address it earlier could lead to developing of chronic pain. And at that point, it may be challenging to treat and address.
Thank you, Dr. Gerges. I've often found a similar pattern in my pediatric patients as well, where pain is often dismissed as growing pains, where when we look closer, we actually find more significant conditions. Our next question is for Dr. Abshire. How does chronic back and neck pain affect the brain and mental health over time? And what are some techniques that can help?
Living with chronic pain can really wear on a person in general. That's stress on the body, it's stress on the nervous system. And many people have heard of the body's natural kind of fight or flight response that helps protect us when we're in stressful situations. When we've been dealing with chronic stress or chronic pain, our body is essentially turning on that fight or flight response more frequently and more often. In a sense, the brain is constantly sending this signal saying, danger, something is wrong. I want to do something about this. The problem that can occur when the brain becomes so accustomed to sending this signal is that, the pain might begin to occur even regardless of whether or not there's tissue damage going on. And so chronic back and neck pain can also limit a person's functioning. I don't know a single person who doesn't have some kind of feelings when their pain is limiting the things that they want to be doing, whether that be that they're feeling sad or frustrated or disappointed or lonely because they're not able to do the things they want to do. It's really normal to have some of these emotions that can really ramp up the stress on our body. And so some ways to really help combat this stress really is to regularly try to practice some form of relaxation. And probably the most basic and simple one is doing some deep breathing exercises on a pretty regular basis. I'm also a really big fan of doing some muscle relaxation exercises. This would be essentially kind of going through the body from head to toe, addressing and noticing each different muscle group. So maybe if you start in your face, you take a few moments to just notice if there's any tension in your face. And if so, on an exhale of your breath, you try to just relax and soften those muscles. And you'll kind of move from muscle group to muscle group throughout your body, doing that same thing. Just noticing the tension and then trying to relax it. And this not only helps relax some of that stress going on in our bodies and in our nervous system, but it also actually helps our bodies relax as well and helps some of that muscle tension that can get built up over time relax as well. And so those are just a couple of things that you can begin doing to help tackle some of this chronic stress that comes with the chronic pain.
Thank you, Dr. Abshire. I believe that technique is called progressive muscle relaxation. It's also a great technique to help people sleep as well, in my experience. Dr. Shin, can pain from hip arthritis be felt in the lower back? And how can a patient tell the difference?
Quite honestly, yes, the hip arthritis pain can be felt in the lower back. And this is ongoing thing that I usually have a discussion with my orthopedic surgical colleagues. I sent them patients, I felt that the pain is coming from the hip, and then he would send the patient back thinking it's coming from the back. So it's difficult to tell as a patient. Truly for hip arthritis, degenerative arthritis, typical pain would be coming from the front, the groin aspect of the hip, usually associated with a range of motion loss. So I would ask the patient, do you have any difficulty getting in and out of the car, or moving the leg in and out? If there is some significant decrease in range of motion, or that increases or that brings on the concordant pain, then we would assume that it could be from the hip. However, patients that are having hip arthritis are usually elderly population, and they would also have some findings in the lower back. So when you see a hip x-ray, sometimes you can also see a lower part of the spine. In a lot of the cases, you see a significant deterioration or degeneration of the spine. The orthopedic surgeons will send patients to my service to see, hey, I think the patient's having back pain rather than hip pain. So it's difficult to tell. So in order to really identify, then we would have to go through some process, not only getting the good imaging studies such as MRI of the lumbar spine to delineate the other causes of the back pain. Then we can go through process of diagnostic injections. If there felt to be a significant portion of the hip arthritis, then we would ask for a hip injection. If the patient has a significant relief of pain from that injection, then we could say it's coming from the hip. If there is no improvement with it, then we can then further do other studies looking at the spine, and we can also go through diagnostic spine injections to figure out where the pain is coming from. So the answer to that is very difficult to tell.
Thank you, Dr. Shin. I can tell that can be a puzzle sometimes for patients, for sure. Our next question is for Dr. Gerges. Can back pain from sitting at a desk for 10 years straight be fixed? And if so, how?
Our bodies are not accustomed to be sitting all day long. So yes, because first of all, you get your muscles relaxed. Most of the time, we don't sit in the appropriate sitting position. Our body's designed with what's called lumbar lordosis, and sitting not properly then may get rid of this lumbar lordosis, like slouching, weak, especially if we have weak core muscles. That would lead to chronic back pain, muscle abnormalities, muscle spasm, sometimes even muscle atrophy. So I would advise anyone who has a job that require him to sit for a long, like especially working with computer and stuff like that, is to frequently stand up for a minute or two every 15, 20 minutes, take a walk for a couple of steps and go back again. If you don't have a specific chair with a lumbar support, I would advise as well to maintain your lower back in an erect position using something to support your back. Like the lumbar support in some of the cars right now is basically standard. There is a roll that you can buy. It's called McKinsey roll, and it's not like a promotion. It's named according to the physician who invented this. It's basically a rigid foam that you put it behind your back. It's portable. You can put it in your car. You can put it behind your back when you're sitting. That will support your back. And yes, it does. If you don't do that, you'll develop chronic low back pain.
The next question I'll take. Can spinal stenosis be genetic? What are early symptoms? And what is the best treatment plan that doesn't involve major surgery? Spinal stenosis is a condition of the spine where the space on the inside of the spinal canal is smaller than normal, and that can cause a tight space for the spinal cord as well as the nerves that go inside of the spinal cord. Early symptoms of spinal stenosis can include back pain, as well as weakness or heaviness in the legs where it can be difficult to walk straight up. Oftentimes patients find it's easier to lean forward, leaning on a shopping cart or some other walker, something like that, that can help them relieve pressure off of those nerves in the spinal cord in the back. This is a condition that can be genetic, so some people are born with smaller spinal canals, just like some people are born tall or short. Some people have tighter spinal canals. The best treatment plan for this condition that doesn't involve major surgery, first we usually start with some type of physical therapy to strengthen the core muscles that are supporting the spine. That way the body can use the muscles to support the back rather than the bones themselves. We also will sometimes use medications to try to decrease sensitivity in those nerves so that if they are in a tight space, it's not as painful for them. We also use injections like epidural injections to try to decrease inflammation to help open up those tight spaces as well. So there are a lot of different treatment plans that don't involve major surgery. Our next question, Dr. Gerges, is for you. Just how safe are injections in the spine? How often do they really work? And how long can patients depend on these injections?
Injections for the back, specifically lumbar epidural steroid injection, lumbar facet medial branch nerve block, and lumbar facet radiofrequency ablation, and etc. A lot of more procedures are very safe and has been done for the past decades. And the goal for these injections sometimes not to eliminate the etiology of the pain, but modify and improve the patient's function and patient pain. So avoid surgery and keep them going with daily living activity and what they do and enjoy in life. They're very safe, as I said. There are some standards in limiting the amount of steroids that we inject per year, and pretty much standard for every pain practice. Let's talk about, for example, epidural injection. You were talking about spinal stenosis. One of the injections indicated for this condition is epidural steroid injection. It's very quick procedure, less than 3 to 5 minutes to do, the interventionalist time. It's been done for decades, as I said. Low risk, low complication profile. And if it's done for appropriate diagnosis, it improves patients' outcome and patient health-wise and function. Other procedures basically is like, for example, the most commonly done one right now is lumbar facet medial nerve block. And this is basically a test to see if this is a source of the pain. Like Dr. Shen mentioned before, for the hip, we do sometimes a test, inject the hip to see if the pain coming from the hip, this is a source of the pain. For example, we do the block and monitor the patient's pain for 6 to 8 hours after the block. If the patient responds in favor of this is the main source of the pain, like getting like 80% pain improvement, then we are sure now that this is the main source of the pain. We can tackle that with an advanced procedure called radiofrequency ablation and treat. Very safe as well, very minimally invasive. It's in and out in the same day. The majority of the procedures that we do are well studied and done for many years, and the outcome is monitored, and they improve patients' pain and function as well.
Thank you, Dr. Gerges. Our next question goes to Dr. Abshire. How can someone manage the frustration and hopelessness that comes with long-term pain?
There are so many techniques that we can use to manage frustration and hopelessness. I think this is something that I spend usually multiple sessions on with a person, just working through some of this frustration and hopelessness that can come up over and over again too at times. And I think that's because of how long the pain goes on for, as well as how the pain may vary in the level of impact that it's having on a person's functioning. I also want to encourage anyone out there that is maybe feeling this way to reach out for support, whether that be establishing with a pain psychologist or a regular therapist, or really building a good support system with friends and family. I think creating a good support system can be a really crucial component here when trying to navigate some of these more difficult emotions that can come up when dealing with pain, because it can be really easy to become isolated when we're dealing with chronic pain. And that isolation really tends to amplify some of these feelings of frustration or hopelessness that we might be having and experiencing, because it causes us to focus a little bit more on the pain, versus when we're able to engage with other people, we can kind of bring our focus and attention more onto some other things in our lives. One of the things that I really encourage people that are dealing with this and are dealing with chronic pain to do is to really focus on thinking about, what can I do today? And try to focus on those things that you can do and that you are able to do. Doing this really helps shift our mindset and our focus into something more productive and proactive for us. And along with this, I encourage people to set really small, achievable goals for themselves every single day. By setting these small goals and making sure there's something that we can actually achieve, we actually help build up some confidence that there are still things that we're able to do, and that we do have a little bit more control over this experience. It also helps our mind shift to some of the things that we can actually do to be proactive in managing the pain. I'm also a really big fan of setting mantras or having different coping statements that we can say to ourselves when we're feeling maybe more overwhelmed or stressed. Maybe things like, in this moment, I'm okay, or I can get through this, or the pain has been at 10 out of 10 before and eventually it came back down. I know this is going to come back down too for me. All of these statements really just help kind of calm a person down, right? It's not adding extra stress to the situation. It's something that's kind of self-soothing for oneself. And another way that I like to address this is to encourage people to actually shoot for neutral thoughts. So I very often hear people say, well, just be positive, just think positively. And if that works for you, fantastic, great, keep doing it. For many people living with pain, maybe that positivity just feels kind of unrealistic for them. Or maybe it feels like they're setting themselves up for disappointment or not being able to meet those expectations that they placed on themselves. And so that's where I think it's important to sometimes just shoot for some kind of neutral thought or neutral statement that you can say to yourself that isn't necessarily positive, but it's not dragging you down into maybe some of the more of these like frustrated or hopeless thoughts that you might be experiencing as well. And again, I think trying to do anything you can to help relax the nervous system, anything that's soothing and calming for you, and having some distractions and things that you can do when you are starting to feel this way as well.
Thank you, Dr. Abshire. I think that's also why it's very important to have conversations like the ones that we are having today, so that patients know there are treatment options out there. There are medical providers and psychology providers that can be helpful and be a part of your team to give you some hope back. Our next question is for Dr. Shin. Is exercise good or bad for neck pain and back pain? Can some exercises like long walks actually make pain worse?
The general answer to that is absolutely. Exercise is good for chronic neck and back pain. Obviously, before the recommendation can be made that we do have to do an examination, make sure that there are no underlying conditions and it's safe to do the exercise. But generally, for chronic conditions, due to mostly from degeneration, usually musculoskeletal pain, could be poor posture, could be weakness, could be poor habits in general. And when we talk about pain control in those type of setting, we think of things that can help us. We think of maybe medications, maybe we think of maybe other treatment modalities such as massaging or heat or ice, those kind of modalities. But ultimately, exercise is an active involvement in treating or really ongoing sort of improvement with your condition, your chronic condition. So I highly, once you have ruled out other causes of this chronic condition, then exercise is really important. I recommend my patients that if they can minimally spend 20 or 30 minutes 2 or 3 times a week and doing the active exercises, ultimately it's going to help them and slow down their degenerative process of their neck or lower back spine. Exercise, there are many different type of exercises that will be helpful, that can be helpful to chronic condition. When you're not sure what to do in some cases, and I have patients ask me that all the time, going, I can't do this, I can't do that. And I would say, well, if you don't know what to do, then basically get up and walk. So the question about walking, is that good? Absolutely. Now, walking is weight-bearing exercise. When you walk, you're using all different muscle groups. You're using muscle groups of the cervical spine, your lumbar spine, and they're moving. And you're staying upright position, requiring all muscle groups to work for you. It's also good for your joints and long-term benefits to osteoporosis, along with good diet and good sleeping habits. So yeah, exercise are good, and I highly recommend it. And if not sure what to do, then I certainly recommend getting up and taking a brief walk.
That takes us right into our next question for Dr. Gerges. What are some of the best resources for exercises and activities to do at home to help with chronic lower back pain?
We're going to talk about also multidisciplinary approach. Psychological support is a crucial part of this. Also physical therapy. So medically guided exercises for chronic pain is very important. For example, if a patient have an acute disc herniation with what's called radiculopathy or pain shooting down his lower extremity or leg, then there are certain exercises that he need to learn from a certified physical therapist so he will not hurt himself or a patient not hurt himself. There will be certain movement that a patient would need to learn when they need to lean forward or carry heavier than normal object. There is a certain way of how to do that. So seek experts' opinion, mainly physical therapist or chiropractor, or a physician when you have chronic back pain or acute back pain, secondary to disc problem or secondary to any other issue that caused that pain.
I'll take the next one. If someone has tried pain medications and physical therapy and still has chronic back pain, what are other non-surgical options out there? The biggest thing that it depends on is what type of back pain they have or what is the cause of back pain. There are different types of injections that can be done, whether that's trigger point injections into the muscles, epidural injections into the spine, facet or medial branch injections into the joints of the back, as well as making sure there's not other structures that are affected. And so there's a lot of different options in terms of injections where steroids or numbing medicines are injected. We do have more advanced procedures as well that have been mentioned briefly today. For example, like a radiofrequency ablation, where the nerves in the back that feel pain are deactivated with heat. That is potentially an option for certain types of back pain, as well as more advanced interventional options like spinal cord stimulation, which involves implanting a device into the spine. While it is a minimal surgery that's done during that, it's reversible and it's not as intense or as permanent as a lot of different spine surgeries are. So in general, there are a lot of non-surgical options out there, and it really depends on having a good medical team to help guide you through those options. Our next question is for you, Dr. Shin. How significantly does diet, nutrition, and hydration impact back pain? And what are some nutrition tips that can be helpful?
We're in chronic condition, chronic pain, a little things help. So diet, nutrition, hydration, very important. Diet's heavy in sugar, fat content, sugary snacks, omega-6 type of containing food are known to cause increased inflammation of our body. And general inflammation contributes to pain in chronic condition. So avoiding those type of food will help to reduce the inflammatory process and ultimately pain. So in terms of good diet, example would be like a Mediterranean diet, high in fruits and nuts and olive oil and low in red meat, poultry, fish, and moderate amounts. There are other factors there, but those are good for what we consider to be an anti-inflammatory diet and overall general healthy diet. Those are highly recommended in chronic pain conditions. In terms of hydration is also very important. Hydration relates to the healthiness of our discs. It's very important that our discs are in the range of 70% to maybe 80%. It's a water content. And in order to maintain our discs, hydration is very important. Also, the circulation to the disc. So we were also mentioning about sitting for long periods of time earlier. Long periods of time where our muscles are relaxing and our weight is compressing down on our disc. And that is going to compress the disc for if you're sitting for long periods of time. That will then diminish some of the flow to the disc. And if you do that chronically, then the disc can dry out. And then once the disc dries out, then there's more potential for injuries and quicker accelerated stages of degenerative disc disease. So hydration is very important. But that combination with diet and exercise, those are really critical components where you can keep your back healthy for much longer and prevent injury.
Some population have, tendency to develop inflammation secondary to consuming dairy products. And one of the anti-inflammatory diets right now available, and it's available on the clinic website as well, is to avoid or eliminate dairy products. And I have done that with some of my patients that they have consistently having chronic all over body pain. They eliminated dairy products for 2 weeks and they reported significant improvement of their overall function and overall pain. So sometimes in certain population, dairy products could be the reason for their inflammatory process going on and causing their chronic pain. So that's something to consider as well.
I always tell my patients that the only way to get the body stronger and to heal is to get good nutrition. So I think that goes along well with the messages that you guys are putting out there as well. Our next question is for Dr. Abshire. What are some ways to stay hopeful and motivated when living with chronic back and neck pain?
This one actually ties back very nicely to a couple of the other questions that have been asked here as well. We already touched on how easy it is to kind of get down and frustrated or hopeless. But I think really setting some of those small achievable goals that are attainable for you can be huge here. And on top of that, I really strongly encourage people to start practicing what's called activity pacing. Very often, I find that people who have chronic pain get kind of stuck in what's called this boom or bust cycle of chronic pain, where they have a quote unquote good pain day. And I always put the good in quotes because, I know typically even when it's a good day, the patient with chronic pain is probably still in pain. And so they're having a good day. So they go out and they do everything they possibly can. Right? Maybe they're cleaning their whole house. Maybe they're going and getting all of their groceries and running errands. And they're trying to cram everything in until they kind of crash. And depending on the type of pain that they have and how much activity they did, maybe they're down for just a few hours, or maybe they're down for a day or more, kind of recovering from that overexertion that happened during that good period of time. And so I encourage people to try to do about the same amount of activity every single day. And so that similar amount of activity that is done on a day-to-day basis can really help build up some of that strength in the body versus the overexertion and the crashing that happens after that and the flare that happens after that. Because when we are having that flare, our body tends to start to get a little bit deconditioned. And that's when we tend to sink into a little bit more of that hopelessness and frustration as well. And so if we can maintain a similar amount of activity every single day, one, our body tends to get a little bit stronger, which means that over time, we can slowly start increasing that activity. But two, it actually helps build up some confidence as well and helps build up some of that motivation when you're starting to get some of those wins of, yes, I was able to accomplish, doing all of the dishes today. That was my big goal and I managed to do it and I don't feel completely spent afterward. With activity pacing, I usually encourage people to break up activities or tasks based on the amount of time they spend doing a task, rather than task completion. And so what that means is, let's say it would take 20 minutes to complete a task from start to finish. Maybe instead of doing that full 20 minutes, you do 10 minutes and then you take a break for a few minutes and then you go back and do the next 10 minutes. That's what I mean by pacing things out a little bit so that you're not doing it all at once and burning yourself out, maybe putting a lot of strain on your back or neck all at one moment. And you're giving your body a moment to rest in between. That can really help you, one, accomplish more activities and tasks throughout the day. But two, I do think it helps build up some of that hopefulness and motivation when you're not spending quite as much time recovering from overdoing it with activity.
Thank you, Dr. Abshire. The next question goes back to me. Can you give details about a spinal cord stimulator and what is it best used for? So a spinal cord stimulator is an electronic device that's implanted in the body. Specifically, there's a small wire that goes inside of the spinal canal and lays on top of the spinal cord. And then there's a battery pack that's implanted under the skin. This is a more advanced procedure, and so there's different reasons why we might use it. Most specifically, it's used for different types of nerve pain, like complex regional pain syndrome, CRPS, or reflex sympathetic dystrophy, RSD. Sometimes it's also used in neuropathy type pain as well, or it's used in pain that continues despite spine surgeries. And so because it's a more advanced procedure, there is more of a process about getting it implanted, making sure that from an evaluation standpoint, it's the most appropriate thing to use. This is not one of the treatments that we usually start off with for people, but oftentimes people do end up needing this treatment if other things don't work for them. And so it is something that a lot of people get benefit from, but it is a more difficult and more serious decision to make. And so that's something that we work with patients every day to talk about if that's an appropriate thing for them and if that makes sense for their life as well as their pain condition.
I would like to add a couple of more things that I do. Spinal cord stimulation for refractory diabetic neuropathy now is one of the FDA-approved indication for spinal cord stimulation. I've done it for some of the patients, and the results are promising. And we found also that there is improvement in their hemoglobin A1C, which tracks the blood glucose over 3 months in the red blood cells. And that indicate that there is good control of their pain, lowering the hormones that elevate their blood glucose. And the patients are happy because they have been trying medications many times and multiple approaches to treat this diabetic neuropathy. And in the end, as Dr. Bismer said, it's not always the first line of treatment, but it's there for this kind of population. One other indication for ischemia as well, lower extremity, I want to say it in layman term, like low blood flow to the lower extremity. Spinal cord stimulation is indicated as well for this condition, as it blocked one of the systems called sympathetic nervous system. This system is responsible for controlling the blood vessel tone. And if you block this system through this device, the spinal cord stimulation, the blood vessels will dilate and improve the blood circulation to the lower extremity. It's been done for this problem as well.
Next question actually goes right back to you. At what point do you recommend moving on from pain management and trying to manage pain and think that it's time for surgery?
I'm on a conservative side when it comes to surgery, because quite a portion of our practice is pain after surgery, persistent pain after surgery, or failed back syndrome, or lumbar post-laminectomy syndrome. So I'm kind of the conservative side, try to do the multidisciplinary approach to treat any pain using medication. In all terms, non-steroidal medication, muscle relaxant, exercises, physical therapy, psychological support with Dr. Abshire, very important, because no pain without some sort of mood changes or depressive symptoms. All of this, in the end, we do, as interventionalists, we do Some procedures, like you mentioned, epidural injection, facet nerve block, radiofrequency ablation, mild procedure, spinal cord stimulation. All of these are remedies and approved to treat and manage pain, improve function, avoiding surgery and its complications. There are also some portion of our patients that they are not candidate for surgery, even they are have a problem that could be corrected surgically. They are not a candidate for a reason or another, and these modalities come into play for these situations. So again, I'm not advocate for surgery unless there is, significant changes, weakness, loss of bowel bladder control, that will require an immediate intervention or emergency intervention, as we say. So conservative side first. If it's exhausted, then we can consider surgery.
Next one is for you, Dr. Shin. Is heat or cold better for back pain?
Get this question from our patients a lot. So to kind of explain that, I try to give examples such as someone spraining an ankle, and there's an acute injury that can result in significant swelling. So the recommendation for that is ice it, so that the swelling can limit the swelling or inflammation. So cold or ice in this situation makes sense. Certainly wouldn't recommend heat when there is an acute injury. For my patients, they have a lot of chronic conditions. So when they come in and ask whether heat or cold is better, the context of how you use that is very important. If it's providing some temporary relief of pain to be engaged in some exercise or activities, then certainly either is fine. Another scenario would be if you feel like your muscles are really tight, and if you sat in a hot tub for a half hour, you'd feel better. Muscles get a little bit relaxed, then you feel better. That's where the heat kind of comes in. But the use of the heating pads have been kind of been concerning in some of the patients where they seem to use it for too long. And I see a lot of skin burns from using, they feel comfortable, been using for too long a period of time. And I do see some skin burns with it. That can be also true with ice, but typically with heat, I see that quite a bit. So I advise my patients, you can use either heat or ice or cold, but shorter period of time. If it's heat, maybe limit to 20 to 30 minutes. But if it does provide some temporary relief, then it's best to utilize that time to do something. If you're just using heat to just help with that temporary pain, then that would not be a good solution or good recommendation.
I'll take the next question. What is the opinion on cortisone shots into the facet joints in the neck? Well, the facet joints are the joints that make up the spinal column, the bones in the neck where they meet each other. Those are the facet joints. Sometimes arthritis can develop in these joints where there's swelling or inflammation, bone spurs, different types of degeneration changes. This can cause pain in those joints and pain when patients move their neck. Cortisone injections into those joints is part of a multidisciplinary treatment for this type of pain. Sometimes we do nerve blocks to the nerves that go to these joints. Sometimes we can inject cortisone into them or around those joints or around the nerves. Oftentimes, if these numbing medicine injections are helpful, we can move on to a more advanced procedure called a radiofrequency ablation, which can provide 6 to 12 months of relief. Basically, we deactivate those nerves using heat, and so eventually those nerves do tend to grow back, but we can get some long-lasting relief in the meantime, and hopefully actually strengthen those muscles that support those joints in the neck, so that when those nerves grow back, maybe there isn't as much pain. Of course, none of these treatments get rid of the arthritis, but it can help with the pain that comes along with that. Our next question goes to Dr. Shin. How promising are the new therapies like platelet-rich plasma, PRP, and stem cell injections for inflammation and joint pain as well as spine-related issues?
The stem cell, mostly in our community, we call it mesenchymal stem cell treatments. PRP, platelet-rich plasma, is where the blood is taken from you and it's spun, and the PRP is then injected into different areas of the body. Now, most frequently, most commonly, it's been done at the arthritis and joints. And they've seen some positive improvement on those patients that suffer knee pain or joint pain. As far as the back pain is concerned, in terms of facet arthritis or discogenic back pain, there are some small studies indicate that these can be helpful, but there has not been a large control study to prove that these are at this point, recommended treatments. The stem cell treatments are also somewhat complicated. Mostly it would be taken from you from either your bone marrow, and it's then injected into these sites. Most frequently in the spine area, we're looking at the facet joints area, people with discogenic back pain, intradiscal injections to regenerate the tissue in these areas. But the study has been somewhat positive in some studies, but it's been inconclusive. So at this point, it's an emerging sort of study, emerging treatment options, but with positive sort of hope in the future that it can be used for chronic condition.
So team, we have time for one final question. It goes to Dr. Abshire. Are there any new or emerging psychological treatments for chronic neck and back pain that show promise?
There absolutely are. Just to begin with, for those that aren't familiar with the different kinds of psychological interventions there are in general for chronic pain. So cognitive behavioral therapy for pain, or CBT for pain for short, is kind of always been considered the gold standard of treatment psychologically for chronic pain. But we've also seen some really good research to support acceptance commitment therapy for pain, mindfulness-based therapies where we're working on relaxing the nervous system, biofeedback, which is where you are usually hooked up to a device that will show you some of your own body's maybe heart rates or perspiration while you're working on doing some kind of relaxation exercise. And hypnosis has also been proven to be effective in helping manage some of the pain as well. One of the more recent treatments that has come out in the recent years is emotional awareness and expression therapy, or EAET. This is a new type of psychotherapy that has come out that really seeks to treat chronic pain by addressing some of the really difficult emotions that an individual may be experiencing, or maybe that an individual may be kind of suppressing or trying not to feel, that might be actually contributing to some of their pain experience. We know that things like past traumas that a person has experienced can certainly increase the risk for chronic pain. And so this treatment really seeks to kind of process through some of those past traumas, really address emotional conflict and stress, and try to work through and experience some of those emotions in a safe environment. And so that newer treatment therapy is certainly on the horizon, but the preliminary research has been pretty effective, and I think at this point shown to be about as effective as cognitive behavioral therapy for pain too. So a really promising and exciting treatment that has come out in the last few years.
I'd like to say thank you to our panelists today for your expertise and your participation. Cleveland Clinic's Neurological Institute includes more than 700 medical and surgical specialists dedicated to making life better today, while discovering treatments for tomorrow for adults and children who have brain, spine, and nervous system disorders. Our specialists see patients at locations all across Northeast Ohio as well as around the world. We specialize in the entire spectrum of disorders, handling everything from the most common to the most complex, from back pain and brain tumors to multiple sclerosis and Alzheimer's disease and more. Before the end of the week, you will receive an email with back and neck health resources, details on how to make an appointment, and a link to the recording of this event so you can view it again. If you have more questions, feel free to call us at 216-636-5860. Thank you for watching.